Hello. In chapter 2, we're talking about neurodevelopment disorders. These are disorders that are characterized by abnormalities in brain development, affecting emotion, learning ability, self control, and memory that unfolds as the person grows, right? So, along with the early onset of symptoms, these disorders have traditionally been acknowledged when development of the nervous system is disturbed, leading to structurally comprised in the brain. So there's numerous causes that contribute to the development of neurodevelopmental disorders that range from child depression, genetic and metabolic diseases, immune disorder deficiencies, infectious diseases, nutrition, trauma, and toxic and environmental factors. So intellectual disability. This is a disorder that appears before adulthood, characterized by individuals significantly impaired cognitive functioning and deficit in adaptive behaviors, for example, self-help, communication, and interpersonal skills. So differential assessment. Congruent with DSM-5 dimensional approach to diagnosis, intellectual disability takes into account that children's adaptive functioning with IQ scores. The practitioner will consider the intellectual functions. Individuals scoring with a range of 65 to 75 are thought to have intellectual disability. Adaptive functioning in multiple environments such as home, school, work, community. Um, the information is provided by a collateral source, a family member or a person that knows the person, right? And by the observation of the practitioner. Autism spectrum disorder. This is a developmental disorder where the severity differs from person to person. It encompasses the previous DSM-4 diagnosis of autism, Asperger's syndrome, which is now part of autism, childhood disintegrative disorder, and pervasive development disorder are not other specified neurodevelopment disorders. So it's characterized by social deficits and communication difficulties, stereotyped by repetitive behaviors and interests, and in some instances, cognitive delays. So the differential assessment for autism spectrum disorder, right? So social communication symptoms. The diagnostic criteria includes problems in social, emotional reciprocity, such as the give and take in conversations or reduced share of interest, emotions, and affect. The second domain that characterizes ACD is restricted, repetitive patterns of behaviors that can be stereotyped of repetitive motor movements. And the DSM-5 provides a chart describing these domains. So specifiers for autism spectrum disorder: with or without accompanying intellectual impairment, with or without accompanying language development, associated with known medical or genetic conditions of environmental factors, and associated with another neurodevelopmental, mental, or behavioral disorder, or with catatonia. ADHD, attention deficit or hyperactive disorder. The key distinguishers for ADHD are inattention and or lack of focus, executive functioning difficulties, impulsivity, and hyperactivity beyond what is to be expected of a person's normal age. The key diagnostic criteria for ADHD are inattention and hyperactivity, impulsivity that is present for the age of 12 years, and get in the way with the person's functioning or development. Symptoms must be present for at least 6 months. A psychotic disorder or another mental disorder, like anxiety disorder, dissociative disorder, personality disorder, or substance intoxication or withdrawal, does not better explain the symptom picture. ADHD and specific attention to inattention. A child must show 6 of the following criteria: does not pay close attention to details, have difficulty remaining focused or paying attention, does not seem to listen and seems to be elsewhere, does not allow through with instructions, does not follow through with instructions, and fails to finish schoolwork, disorganized, messy, fails to meet deadlines, is poor time management, avoids, dislikes, and is reluctant to engage in tasks that require sustained mental effort, often loses things needed to complete tasks and activities such as books, school supplies, and keys, eyeglasses, and mobile phone, often easily distracted by a string of stimuli, and often forgetful in daily activities such as choices or for adolescents and adults, returning calls, paying bills, and keeping appointments. Hyperactivity and impulsivity with ADHD. You're talking about excessive motor activities, seen in fidgeting, tapping, or squirming. Often leaves his or her seat when staying seated is expected. Often runs around, and for adults seems restless. Often unable to play quietly or engage in leisure activities. Unable to sit still for an extended period of time. Often talks excessively. Often blurts out answers before the question is completed. And often has difficulty waiting for his or her turn, and excessively interrupts others. So specifiers will be combined presentation. Those are kids who are going to have hyperactivity and inattention, right? And they're evident for 6 months. Predominantly inattentive. Those are kids who are going to present with those more inattentive symptoms. Kids that are primarily hyperactive is just going to present with more of those hyperactive symptoms. And the diagnosis can be further refined by remission, specifically in partial remission. Severity can also be assigned, ranging from mild, moderate, and severe. The communication disorders. These disorders affect the individual's ability to communicate to the extent that it interferes with schoolwork or relationships, like a language disorder. Key features to be the difficulty in learning and using language that involves the process of linguistic information. Speech and the speech sound disorder describes problems with pronunciation or articulation of the extent that interfere with being understood. Child onset fluency disorder. This is reserved for frequent, persistent, and marked instances of stuttering that causes problems for the individual, such as anxiety about speaking and limited effective communication and social participation. Social communication disorder refers to difficulties in social use of verbal communication, which affects social participation, relationships, academic achievement, and job performance. An unspecified communication disorder reserved for those who have symptoms of a communication disorder but do not meet the full criteria of the disorder. Specific learning disorder describes the difficulties learning and using academic skills and affects a child's ability to acquire and apply reading, writing, and or math skills. Specific areas of impairment are designated through specifiers. For example, impairment is reading, written expression, or mathematics. Their particular area of impairment are designated in the diagnosis. Severity is also specified, ranging from mild to moderate to severe. Motor disorders, grouped with a new subcategory of the neurodevelopmental disorders that includes developmental coordination disorder, also known as dyspraxia, or the pejorative term clumsy child syndrome. Stereotypic movement disorder involves repetitive, non-functioning motor behavior, and tic disorders, distinguished by the presence of motor and vocal tics, and organized around the categories of Tourette disorder, persistent motor and vocal tic disorder, or provisional tic disorder, or other specified tic disorders. Finally, the DSM-5 has changed a lot from the DSM-4, going from that multi-axis system and whatnot. And there were some big changes that came with DSM-5. For instance, the term mental retardation has been named intellectual disability. The formal the formal phenomenology disorder and stuttering are now called communication disorders, including language disorder, speech disorder, child onset and fluency disorder. Autism spectrum disorder now incorporates formally the Asperger childhood disintegrative disorder and pervasive development disorder. And a new subcategory of motor tic disorder has been added. So those things are all new to the DSM-5.